Good evening, good evening, good evening. I am so excited you joined me this evening. Tonight on Dr. Melissa Medicine Woman, we are going to be talking about the pause. That's right, menopause. I know it's a topic that so many people have asked me to teach on. And so that's what we're talking about tonight. We're going to start with part one tonight because there's a lot of information to cover, both when it comes to what actually it is, what is peri, what is post, and what is menopause, and the medications that are used to treat or help with symptoms of perimenopause and menopause, as well as supplements that are used. So before we get started tonight, I do have a disclaimer I'd like to share with you. And so let me pull that up. And just to let you know that this show and all the content are for educational purposes only, not intended to diagnose you, to treat, to cure, or prevent any disease or psychological disorder. A specific physician, patient, or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician, your pharmacist, or your other qualified healthcare provider with questions about your medical conditions before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. So, who is Dr. Melissa Medicine Woman? Well, I have over 26 years of experience in both Eastern and Western medicine. I have been in the healthcare arena for a very long time. I earned my doctorate of pharmacy, so I am your concierge consultant pharmacist, using my knowledge to help you optimize your medications and your supplements. Just because you've been put on a medication does not mean that you are on it for life. There are choices that you have. And my physician friends call me the deprescriber because I do go in and help you clean up your medication list and get you healthier, get rid of things that are no longer necessary. We come up with other things in place, whether that's integrative medicine, including lifestyle medicine, other supplementations. We look at labs, we look at all kinds of things to make sure that you are living your best life now and that we are incorporating whole body health, which is the physical, the mental, the spiritual, and the emotional health. Because when you go in for just your arm to be fixed, you might have another trigger in there. And so we need to look at everything that goes along with it. So let's get started tonight and talk about what is menopause. Now, menopause is a natural event. It occurs normally, usually for women between the ages of 45 and 55 is when it typically starts. And what this is when a woman transitions from her considered fertile years to her non-fertile years. There's a decline in estrogen, which is a hormone. There's the estradiol, there's estrone, and estriol. All of those are estrogen hormones that we have in our body. And there's an increase in FSH, or follicle stimulating hormone. Okay. And those two hormones are in balance during our lifetime. And some are higher, some are lower, depending upon where we're at, whether we're in our fertile or our non-fertile years. And so as we've passed into our non-fertile years, our hormones change. Okay. Now, the transition into menopause is called perimenopause. Now, this is usually when your menstrual periods kind of start to gradually become more irregular. They can be more close together or more widely spread apart. Now, this stage can happen anywhere from 1 to 5 years before your menstruation actually completely stops. Okay. And when it completely stops, you're in menopause. Okay. You've completely stopped. But during this perimenopause phase, there's changes that can happen with your hormones. There's starting those changes in estrogen and FSH. And so you're considered clinically in menopause if you have not had a period for 12 consecutive months. Now, this is when you are at that age and you're not on any contraceptive devices. So there's a lot of devices out there these days that make it so that you don't have your period. Okay, you're not having a menstrual cycle at all. So some of the IUDs that are out there, some of the birth control pills that are out there, those can actually stop the flow as well. Now that doesn't mean you're in menopause. Okay, so if you are being pharmaceutically assisted, that is different. You are on nothing at this point, and you have not had for 12 consecutive months, so a full year, you're considered to be in menopause. Now, every single woman is different. That's right. There might be some similarities, but each woman is different. Menstrual flow can just completely come to a halt, and your hormone levels change. Some people, it takes that perimenopausal 1 to 5 years, and they go through the fluctuation. They think they're done, and then they're not. And other things that are different from woman to woman. Your symptoms of what can be experienced during the perimenopause phase and the menopause phase. Now, I'm sure everybody on here has heard of hot flashes. Okay, so we're going to talk about the different symptoms that can occur or that I have seen clinically. I have seen with my patients, my clients, and some things. So some things, there's more to it than just hot flashes, and the symptoms could be mild, they could be moderate, and they can be severe. So one woman could have very, very severe hot flashes and have them at night, and we call those typically night sweats, while another may have a very, very mild case and get a little tiny bit of hot flash during the day and be fine. So it depends. Each of us are unique, okay? And so you can get an idea, a guideline by talking with your family members, your moms, your sisters, your aunts, because it is genetically that if your mom had a very mild, then genetically you might have a very mild, but then of course you may have different symptoms as well. You could have more severe. It just depends, but talking with your relatives, you might get an idea of what to experience. Now, we talked about the hot flashes, okay? Hot flashes, skin flushing, getting red, night sweats. That's when you're laying in bed and it could be 60 degrees and you are dripping sweat, okay? Insomnia can make you not sleep very well. Your hormones have a huge role in our sleeping patterns. And when our estrogen is changing, our sleeping patterns can be off. To get mood swings, irritability, depression, anxiety, these are symptoms of perimenopause and menopause, okay? Of course, the irregular menstrual periods, you could have spotting, you could have blood, you could go months without anything, but not a full 12. And then all of a sudden you have it again. There could be vaginal dryness, painful sexual intercourse. This is a huge one, okay? Decreased sex drive, vaginal infections, urinary tract infections, and joint pain. Yes, joint pain. The long-term effects of menopause, it has been shown to lead to bone loss and even osteoporosis. Okay, so we're going to talk about some supplements tonight to help with that. It can affect your cholesterol level. It can change your risk of heart disease. Okay, so going into menopause, because your estrogen levels have changed, it changes your risk for heart disease. Now, there's different tests. We can test to see how much estrogen you have in your body, how much estradiol, how much of the follicle stimulating hormone, how much of the luteinizing hormone. We can do bone density scans. We can do various things to see where you're at within your perimenopause or menopause phase. But if you're experiencing any of these symptoms, and that's something, number one, start asking talking to your family members, start asking your physician, if you're in that age bracket, 45 to 55 is typically where it can start. Okay. Now, some things that you can do to kind of help manage the symptoms of especially the night sweats, the insomnia, dress in layers. Okay. The hot flashes, dress in layers so that you can, if you start getting hot, you can start taking off your sweater, things like that. So dress in layers, reduce the amount of caffeine, alcohol, and spicy foods, because those three things can heat up our internal system. You can practice slow, deep breathing whenever you do get a hot flash. So if you get a hot flash, take a nice deep breath in, hold it for the count of 4, and release it. Okay. Do that a couple of times. That helps change our brain, and it helps change the chemistry, and it helps you get through that hot flash. Sometimes eating certain types of food, changing your nutrition, can make a difference in especially your hot flashes. Now, when we talk about the vaginal dryness and the sexual pain that can have because of the vaginal dryness, we'll get more into that on probably our next one. But doing things like having lubricants for intercourse is going to be helpful for you. Exercising, don't like that word, moving regularly, because exercise is that's just that's not a word I like to say. I like to say movement. And we want you to be functionally moving. We've talked about this in the past. Continue to be able to move, strong bones, healthy muscles, moving on a consistent, regular basis. Okay. So there's different things. So we talked about that sometimes it can cause mood swings, anxiety, depression. And so often, first sign out the door, your physician may prescribe you an antidepressant. Okay. Now that might be a good thing, because several of them can actually help with the hot flashes, especially if that's what you're having. If you're having the anxiety or the depression, that could be helpful for you. There could be a medication that's used to help control your blood pressure that also does help a little bit with some night sweats. That's clonidine. And if you have an increased blood pressure, or you're already taking blood pressure medications, you want to make sure and precaution and check your blood pressure regularly, because that can drop your blood pressure severely, as well as helping with those hot flashes. So that's kind of menopause, perimenopause, the symptoms of what's going on. Now, I'm not going to get into hormone replacement therapy tonight. We will talk about that a little bit in the future, maybe next week. What I want to talk to you about tonight is some specific supplements that are utilized. Okay. And these specific supplements, now, please remember that supplements, just like medications, can have interactions. Okay. Supplements can act with other supplements. They can interact with your medications. They can have side effects. So I'm going to talk about some of the popular ones tonight, and a couple of things that you may have heard of. We'll talk about more next time. But let's start with black cohosh. So black cohosh has been around for a while, and is actually one of the most well-studied supplements out there for menopause. It's one that I recommend a lot of the time for my clients and my patients, because it has been found to be helpful, especially with those hot flashes. Okay. Now, there is a warning on black cohosh. If you have liver issues, then this is not the medication for you. Okay. So when you're taking the black cohosh, you want to make sure with any supplement, high quality, good quality, making sure that it's manufactured in a good manufacturing plant, that they are doing their due diligence, that they're doing their safety checks, that they're checking their raw materials, that they're checking a number of different things. Not all companies are equal. If you want specific supplements, reach out to me. And I'll put a link at the end here in just a minute, at the end of the show, where you can reach out to me and you can ask me. We can get you set up for a specific supplement, a good high quality supplement, not very expensive. Most of these supplements that I recommend, they are good high quality supplementation. Every single one of them is good high quality supplementation. And most of them are reasonably, actually all of them are reasonably priced. Let me just show you that. They're all reasonably priced. Okay. So when you're taking something, you want good quality because you want it to work. You want to know that you're getting 3 milligrams in every pill. And you don't know that with supplementation. But if you go with a good quality company, I can tell you that yes, you're going to get 3 milligrams in every pill if it happens to be the dosage of that one. So when we're looking at black cohosh, that is something, be careful with just buying it off the shelf. Okay. You need to go to a reputable office, physician's offices, your pharmacist can recommend a good high quality. Reach out to me. We'll get you set up, ship it right to your house. Okay. I have several ladies who are utilizing a popular, it's actually a combination that has some black cohosh in it because there's other things that you need with menopause. And let's talk about flaxseed. Okay. So flaxseed and flaxseed oil may help with some symptoms of night sweats, especially. Okay. So there is a couple of studies out there that shows some evidence that flaxseed could be beneficial to help with those night sweats. Now, how much do you need? Yes, there are interactions with flaxseed. Flaxseed, it comes as flaxseed oil. It's a fatty acid. Okay. So there's things that can happen with that fatty acid that can affect your stomach. So you might notice some bloating, some gas, possibly diarrhea. So those are things to pay attention to. Of course, there's possible interactions with other medications, especially blood pressure medications, anticoagulants, and some of your diabetic medications can interact with the flaxseed. So let's do a review of your medications to make sure that you're taking something that's safe for you to help you with your symptoms and that's not going to interfere with your other medications. Now, we talked about bones. Bone loss, changes in our estrogen levels can make us susceptible to brittle bones. So getting enough calcium. This is key. Now we might need to do some levels because we don't want you to have too much calcium. So we can do some tests to make sure that you don't get too much calcium in your system. But if you are over the age of 51, then you probably need 1,200 milligrams of calcium per day. That's the recommended amount. Now, calcium comes in all forms. There is calcium acetate, there's calcium lactate, there's calcium carbonate. Those are the ones that are usually most calcium citrate, most readily available. Now, the thing to know about the different salts of the calcium. So that salt, calcium acetate, calcium lactate, calcium citrate, calcium carbonate, those help the calcium be absorbed. Okay. Now, calcium carbonate, which is the most readily available calcium out there, needs to be taken with food to be absorbed. Calcium citrate and calcium lactate don't have to be taken with food to be absorbed appropriately. So you have to know what you're getting. Good high quality supplementation. Let's get it shipped right to your door so you're getting the right thing. And calcium, what salt is best for you? What milligram is best for you? Do you need 1,000 milligrams if you're under 51, or do you need more? Do you need the 1,200 milligrams? Let's check your calcium level to make sure we're not giving you too much calcium. Okay. Now, there's a lot of different calcium products. I was talking to a gal earlier today, and we needed to recommend a calcium product because those calcium pills are kind of big. They're pretty good sized, and they're sometimes hard to swallow, those big pills. And so they do make some chewable calcium, and they even make a very soft chew calcium. Now that soft chew is a good quality brand. The ones that the two that I have on hand, and one of them even tastes like chocolate. So win-win. Get your calcium and get some chocolate in as well. Now, making sure that you've got the right amount of calcium. Now, what else is needed with calcium? Well, calcium and vitamin D kind of go hand in hand. So when we talk about our bones, especially, we want to talk about vitamin D as well. So that's the other supplement I'm going to talk about tonight. Just a few of them because there is so many. I didn't want to overwhelm you all tonight. So, and we will have time for Q&A here in just a little bit. But let's talk about that vitamin D. Now, vitamin D3 or cholecalciferol is the form that you're going to want to get. Good, high quality supplementation. How much vitamin D do you need? Well, we might need to do a level on you. So we do a vitamin D level and we find out if you're normal. Do you live in the northern part of the States? You're probably not getting as much vitamin D from the sunshine. And so you're probably going to need a little higher dose. If you live in the southern states, if you live in Florida and Texas, and you're outside consistently and you're getting your vitamin D from the sunshine, you may not need as much. You might just need a little bit to help protect your bones because, as we said, menopause can put you at risk for osteoporosis. So you could use anywhere from probably 400 units all the way up to 5,000 units is what the pills come in. Now, sometimes I do recommend 10,000 units in a day. And sometimes we have where we're taking a big dose, 50,000 units of vitamin D once a week. Now that is typically a vitamin D2, slightly different form, kind of like a different salt, slightly different form, absorbed a little bit differently and acts to help protect our bones. But the reason we're able to give it over a week is because of the consistency of the makeup of it. So if you have heart disease or kidney disease, then we need to make sure that we check some levels, check to see what you're doing before we just routinely give you some vitamin D, because we want to make sure that your level is right first. Most people in their 40s and 50s, if they're not in those southern states, are going to require anywhere between 2,000 and 5,000 international units of vitamin D3. Okay, so what can happen with vitamin D3? Some side effects. You could have chest pain, shortness of breath. You could, if you overdose on vitamin D2, yes, you can overdose on supplements. You could get weakness. You could have a metallic taste in your mouth, and that's not good. Those are just a few of the things. So vitamin D and calcium help with the bones. We talked about then black cohosh and flaxseed to helping with those hot flashes and night sweats. So that is a little bit about menopause and some of the supplements that are utilized. We will discuss more on our next venture together. For those of you who are watching, I do have a very special offer for you tonight. And let me get that pulled up for you here. My apologies. There we go. So if you go to drmelissabalizan.com/TV, because yes, you're watching the TV show, I have a special offer just for you who are watching the TV show here. Let's get you set up on the right supplementation for menopause. Let's get your medications optimized. Let's review what you're taking and make sure that you're taking the right thing for you. I want to say thank you so much for joining me tonight. All of you who are here, thank you for being here and learning more about menopause. We will discuss more next time. So make sure that you're living your best life now. You only get one body. Take care of your health now. Take care and have a great night.